Thank you very much for the introduction, and good morning, everyone. Nice to meet you all, and thank you for having me today. So I'm here to talk about interoperability. I'm going to start right at the basics and talk through what it is, why it's important, and then some of the challenges and opportunities relating to it as well. So interoperability, if you to Google it, you'd get a statement, something like this. And in a nutshell, what it means is it's about connecting healthcare systems together. So joining up healthcare systems, pulling data together, so we've got a better informed view of what's going on across healthcare. And why does it matter? It matters to, oh, I think we've gone back one. Oh, missed a slide. Slide's missing. Anyway, okay, we'll go into this one. It matters to people, and it matters to patients specifically. And as Paul was mentioning earlier, good healthcare is all about focusing on people. It always starts with people, and it's similar in technology as well. So patients is absolutely at the heart of that. With better interoperability, we can drive better patient outcomes, better patient experiences, increase patient safety. So it's really about having an impact on the patients. It can help clinicians too. It allows clinicians to make better informed decisions. If they've got access to lots of data from lots of different systems all in one place, they've got a full 360-degree view of a patient's care, so they can deliver better care. It matters to the NHS. As we know, there's a lot of challenges at the moment with the NHS, and particularly at the moment with the with integrated care systems, we can see that bringing data together, having a better view of population's health can drive better care. And it matters to life science as well. So if life science can get a better understanding of health data from lots of different sources, it can drive better research as well. So why does interoperability matter to 6B? So this is a photo of my mum and my son. My mum would be gutted if she knew that I've got a photo of her up on a screen right now. She doesn't know about this. So in the same week that I started 6B, which is 8 years ago now, my mum was diagnosed with cancer. She survived and she's healthy, and I'm very grateful for what we experienced from my mum. But we got to see firsthand just how disjointed health systems has a real impact on people, and how that can be quite traumatic for people that are undergoing care. So there were some kind of strange things that happened with my mum at the time, where she'd go for an appointment, a clinician would enter something into a system, print it off, hand it over to my mum. The next appointment, mum would drive 2 miles down the road and hand that same piece of paper to the next clinician, who would frantically type it into another system. And for me, that was just really interesting, because at the same time as starting 6B, we were building all sorts of different tech, web apps, mobile apps for different companies. And we were building all this exciting, interesting tech, and we're thinking, gosh, healthcare just seems so far away from what we're seeing at 6B. So kind of why it matters to 6B is for that reason, really. We just wanted to close the gap between what we're seeing in this exciting, innovative, fast-paced, open, collaborative tech sector to what I was seeing, what my mum was going through in healthcare, which just seemed, pretty slow paced, to be honest, at the time. That was 8 years ago. A lot's changed since then. So the mission at 6B is all about closing that gap and building tech that's going to have a real good, tangible impact on people. And at the moment, we think interoperability in particular, that's our area of expertise. And we think that's the place where we can have the most impact and leverage our skills. So interoperability is nothing new. People have been talking about this for 20 years. We could see since the National Programme of IT, interoperability has been on the NHS's agenda for a long time. So why has change not happened sooner? Why are we still talking about interoperability? We should be kind of beyond this by now, surely. The truth is, it's really complicated. One of the reasons is privacy and security. We're dealing with health data. It's highly sensitive. So rightly so, there's a lot of governance and security wrapped around it, and that adds complication. We've got a decoupled and complex healthcare system. As we've heard from Paul earlier, there's a lot of change underway. There's always been a lot of change underway. Things are moving really fast, particularly in the last couple of years with a lot of digital health innovation that's come along. You can see kind of an average trust, for example, will have up to 200 different clinical IT systems. So it's a complex thing, a lot of systems, a lot of data. And there's a potential for significant harm if it goes wrong. So if a system isn't available, an interoperable system isn't available, or if it is available, but the wrong data is being shared, that can be the difference between life and death. So what's happening right now? So in 2020, we saw the NHS service standard come along. That was an extension of the Gov UK service standard, which is all about building safe digital health products, and interoperability was a big part of that. In 2021, we saw NHS DTAC come along, which some people hopefully will be familiar with this. This is a framework for ensuring digital health is safe and moderated to some degree. There's 5 different criteria that it's scored on, and one of those is interoperability. In 2022, then we've seen the NHS service standard point 17 updated, and the point 17 basically says make your service interoperable. So the NHS is, it's been on the agenda 20 years, but in the last few years things are happening. Also this year, we've seen the Department of Health and Social Care release a joining up of care proposal. We've seen the NHS Transformation Directorate and FCI release an interoperability strategy. We've seen Department of Health and Social Care release another policy called Data Saves Lives, which touches on interoperability a lot. Dr. Timothy Ferris has released a statement about the importance of interoperability this year. Also this year, the CCIO of NHS England has released 7 priority areas for interoperability. The Department of Health and Social Care will release another paper. And we've had 42 integrated care systems launched this year. So I definitely put a lot of emphasis on this year, and there has been other things happening in the previous years. But I do think it's interesting just to zoom out and take a look and think of what legislative and government changes have been happening in interoperability in the last year. There's a lot of noise and a lot of activity. So what have we seen as a result of all of this activity? So from our point of view at 6B, we work with digital health innovators to integrate their platforms, their web apps, mobile apps, and software into healthcare. And one thing that we've certainly seen is a widespread use of HL7 FHIR. HL7 FHIR is an interoperability standard for storing and transporting data. When 6B started working in this 5 years ago, it seemed like a bit of a gamble. It's been around for 10, 12 years, something like that. But 5 years ago, it wasn't that widespread. But in the last couple of years, it certainly is widespread. It's no longer a gamble. It is internationally by far the most used standard. You've got companies like Apple, all of your the healthcare, mobile devices, Apple Watches, all use HL7 FHIR. Amazon have adopted it. Google have adopted it. All of the EHRs in the UK and US adopt it to varying degrees of maturity. But so that's definitely been a thing that I've noticed since we've started working in the last few years. We've seen lots of groups established for interoperability. So HL7, UK and international, Interopen. There's a lot more collaboration around interoperability happening, both for innovators and within healthcare organisations. And then we've seen the evolution of the NHS Digital API platform. And this completely blows my mind, to be honest, because there's over 100 APIs available now through NHS Digital. I feel like I should be a spokesperson for NHS Digital or something. I promise I've got no affiliation whatsoever, but it's genuinely exciting. The NHS, and obviously there's a lot of change happening with NHS Digital at the moment now. But what we are seeing is there's definitely a good community and a lot of support from NHS Digital around interoperability. So what comes next? So I think certainly with the formation of the integrated care systems, only in July, not that long ago, we're going to see a lot of innovation driven through interoperability from integrated care systems. One of the, Paul was mentioning, one of the big agendas for an integrated care system is to get a better understanding of population health data. And the only way you can do that is by joining up systems, pulling data out of those systems and putting them into a platform that we can understand and draw insights from. So I think that's absolutely going to have an impact, and it's going to be very interesting to see the next couple of years. But I also think good interoperability and innovation around interoperability is down to digital health innovators too. There's over 130,000 people employed in digital health in the UK, and there's quite a lot of innovation in Manchester. I'm from Leeds, so I feel like a bit of an intruder today. Probably I can't hide my accent. But you know, in Leeds, in Manchester, in the north, there's a lot of great digital health hubs and a lot of people working in this sector. I think there's a lot of power if we can come together in a similar way to what I see in the tech sector that I love as well. I think it could make and drive quite a lot of change. So ultimately, I think it comes down to trust, open technology, and collaboration. So trust, I think people that are familiar with interoperability, we normally think of it like this. It's lots of different databases talking to each other, moving data between systems. But I think it needs to look a bit more like this, where it's actually people talking to each other, people having conversations. Like Paul was saying, good health, good tech starts with people. And I think there needs to be more trust, both from the patients that are using the platforms, and things like NHS DTAC really help to drive that trust. But also trust between vendors, trust between digital health innovators. Open technology is important for interoperability. Open source in particular. So again, going back to this tech sector that I work in, it's just a given. If we're building something, we make it openly available. We open source code, make IP available. We open source our documentation. And I think it's, I don't see as much in digital health as we should do. There's definitely some good examples. A company that I think is a really good example of that is Patients Knows Best, digital health innovator. They've got some fantastic, got a fantastic open ethos, open documentation. They're really collaborative, and you know, they're a relatively small tech team, but what they put out there and make available to the public is really impressive. We need open standards. HL75 we've talked about, that's absolutely key to that. There's other things like open EHR. There's other things happening around open standards, but that is important. We all need to be talking the same language. And we need to follow tech. So, you know, this tech scene that we love at 6B, that we're really into, I think it does a lot of things right around interoperability to the point where it just isn't a conversation. Of course, if we're building something, it's got APIs, you can integrate with it. And then finally, I think it's collaboration. So in a similar way to we spoke about trust a minute ago, I think we need to drive good collaboration, also from the vendors. So I think a lot of the time when we talk about interoperability from a digital health innovator's point of view, and we're trying to integrate with a health system, it's usually one of these logos on the screen. There's hundreds more, but in particular, the EHR systems in the UK and the US, they hold the keys to a lot of this interoperability. And sometimes it's not as easy as it should be to integrate with these companies. And definitely there's people in this room, and Taz, who I'm trying to not look at every 5 seconds, he knows this pain. But Taz made a really good point, actually, when we spoke a couple of weeks ago. And I think he mentioned, and I think it's right, that we need to call these companies out a bit when they're not offering good support and good interoperability. They all talk about interoperability, talk a good game, but when you're actually trying to boots on the ground work with them, it's not always that same experience. So I think, again, there's 130,000 of us in the UK. Let's come together and let's try and drive more support from these vendors. So that's my closing remarks, really. I think we need to focus on trust, open technology, collaboration. And I think if we do that, follow the tech sector and what we see over there, we can drive better interoperability and more innovation in the NHS. So thank you very much for having me.
Thanks, Paul. I think we all know